Youth substance abuse is an issue in Ottawa. Almost anything can be laced with fentanyl. We're seeing people overdosing on these substances, and people don't know that fentanyl is in the substances they're taking. United Way is a funder of Project STEP. We work with Project STEP by putting our counselors inside the high schools and the elementary schools, doing counseling with the youth who might be abusing or using substances.
Support Project STEP in the fight against fentanyl. Visit project-step.ca/donate.
Yes, it is a major crisis that is sweeping across Canada. As a matter of fact, British Columbia has announced a state of emergency in terms of its healthcare. People are dying every day. And it is certainly hitting Ottawa shores, the fentanyl crisis. Just on a personal note, family friend's daughter passed away at 14. And it was heartbreaking to see what that did to her family. And of course, she didn't know what she was taking. And our next guest, Dennise Taylor-Gilhen from United Way Canada, is very much across this whole situation and actually doing a community response that is feet on the ground.
Yeah.
So welcome to the show.
And thank you.
Yes, and thank you. And tell us what Project STEP is.
Thank you so much for inviting us. One of the things that people don't always know about United Way is that we not only raise funds to invest in community programs, but we also bring the community together on really serious, complex issues, such as the issue of youth addiction. Project STEP is one of those initiatives. We've been working with our community partners, so Ottawa Public Health, the Champlain Lynn, all 4 school boards, Rita Wood, Dave Smith Center, and Maison Fraternité, among others, to look at the issue of youth addiction, to ensure that we have counseling in every single high school in our city, making sure that we can educate and ensure that kids are aware of the issues of substance abuse. That's become more and more important, of course. And we also provide support to parents. So last year we have provided counseling support to 1,400 kids in our city and over 200 parents. And then in terms of education and awareness, over 15,000 young people and their parents have been able to take part in awareness sessions.
Yeah, and I think when we just had this sort of outbreak of fentanyl, you really started with Start the Conversation, and you really pushed that through too, and that's really important. So right away people can go on your website and get information for families.
Absolutely. So project-step.ca is the website, and people can learn more about the initiative, and they also, if they wish, they can make a donation. Of course, because of the fentanyl issue, we know that this is a year that we really need to ramp up the supports, both to parents who are so concerned and so anxious and needing the information to support their children, and also just to be more aware and get the support that they need. And of course, the counseling that is essential. It's important for United Way believes that that every young person in our city deserves a great life, and that means leaving childhood without an addiction. So we really believe that providing support soon and making sure it's readily accessible. 2 other pieces to Project STEP is the residential treatment program.
I was just going to ask you about
this.
This
was a big issue. This was something that, as I was doing the PR around this and trying to get the message out there on the 1310 and elsewhere across the city, that the parents are having to make do. They don't know what they're dealing with, and their 16-year-old has an addiction, and there's no place for them to go.
So for the past 10 years, we've been working with Dave Smith Center and also Maison Fraternité to make sure that there is residential treatment in Ottawa, so kids don't have to leave. However, there's only so many beds. And of course, the big issue is to make sure that we intervene sooner. So if we can get kids before there's actually an issue, so prevention is always the first thing, but early intervention is really important. So Project STEP, the data that we have is really remarkable, and it's very hopeful, and I think that's the other thing that we want people to know, that Project STEP kids that have been part of the counseling program, whether it's in the schools or within our 3 community-based programs, Uville, Operation Come Home, and Wabano. 75% of the kids last year that participated in the survey after programming reduced or stopped using altogether. That's so remarkable.
Great.
You know, it's a very substantial.
And I feel that you know, just to bring it back a little bit, in your video you said that, you know, the kids don't know what's in it, but I think there's also that sense of this will happen to somebody else, or that you know, I'm special. You know, we all have that immortality thing when we're young, and I think that kids are not getting that message enough, that this is it's a roll of the dice.
Well, that's the thing. I mean, we are hearing from our providers that kids are not realizing that fentanyl is actually something that they've been taking. So it's being mixed in with cannabis, with cocaine. It's been pressed into a pill that looks like it's from a pharmaceutical. So I mean, really don't. It's a roll of the dice, as you said.
It really is,
and it really only takes the fentanyl, a piece of the size of a grain of rice, that can actually kill you.
Right, exactly. And you know, and there's even more things coming down the pipe with carfentanil, which could take out an elephant. So,
well, in fact, it was developed as a veterinary medicine.
That's right. So it is fantastic that you guys are doing this work, and it's very much needed, I feel, at this time in the community.
Yeah, so, and the fact that it's through all the schools, and you've pretty much hit all the areas that
so people
are
looking
needed.
for it's project-step.ca
is the website.
Right, and otherwise they can get in touch with United Way.
Yeah, or their guidance counselor in the high school.
Right,
That's
wonderful.
great.
Listen, thank you so much,
Thank
Dennise.
you.
Oh, you're welcome.
And once again, thank you, Julie.
Well, you know
Another
what? You
great
take
day.
care of yourself this weekend with the Junos.
Yes,
It's
and
gonna
we
be
will
fun.
see you on Monday.